Hello class, my name is Trisha Miller, and today I will be discussing the situation involving an Alzheimer's patient that strikes you in the face and breaks your nose. You strike back to defend yourself and you injure the patient. I chose this situation because there are many dementia patients on our floor, and this situation could happen on a daily basis. And unfortunately, there was a dementia patient that was on my unit very recently that was involved in a similar situation. I will discuss the ethical and legal implications of the case, whether the employee has the right to file a claim for workers' compensation benefits, the patient's rights, and how the nurse could have responded to protect the patient. A tort is a civil wrongdoing that causes harm against a person. This is in Wynn 2019, page 70. The four different kinds of torts are negligence, strict liability, intentional torts, and quasi-intentional torts. And that's also in Wynn 2019, page 70. In this case, the nurse strikes the patient in self-defense and injures the patient. She intended to strike the patient, but may not have meant to injure them. This would be an intentional tort. Intentional torts take place when a person intends to cause harm with or without the intention of injury. Wynn 2019, page 70. The nurse meant to strike the patient, like I said, but may not have intended to injure them. The nurse knows that it is not legal or ethical to strike a patient in any situation. Intent would have to be proven in this case. Intent means that a person makes a conscious decision to perform a prohibited action to another person. This is also in Wynn 2019, page 72. The specific tort that took place in this situation is battery. Battery is the actual harmful or offensive touching of another person. Cherry and Jacobs, 2019, page 141. Even placing the fear of hitting a patient without actually doing it is considered assault. Wynn 2019, page 72. Nurses are legally and morally obligated to report suspected or witness abuse or neglect. Healthcare workers who report abuse or whistleblowers are protected. Esseltine, 2019, page 18. Once suspected or witnessed abuse is reported, there is an investigation. Depending on the results of the investigation, a nurse could be charged with fines or even criminal charges in jail time if battery is proven. The nurse could also lose her license to practice. Healthcare providers that are injured from workplace violence are entitled to workers' compensation. Employees can have their medical costs and lost wages covered if they are injured on the job. In this case, the nurse also assaulted the patient. She can still be covered by workers' compensation for her injuries because she was not the one to initiate the physical altercation. Patients also have rights when they are receiving care from healthcare providers. According to Cherry and Jacobs, 2019, page 146 through 149, patients have the right to refuse any care or treatment if they are mentally competent to make decisions. They also have the right to leave the hospital against medical advice and be educated about their health conditions and recommended procedures so that they can give informed consent. Competent patients also have the right to remain unrestrained. In this situation with the nurse being injured by the Alzheimer's patient, she could have taken different actions to protect the patient from injury. She could have called for help from other staff members or security. At Camden Clark, where I work, a code 1 would be called for violent patients. This is called overhead, and you get assistance quickly from other staff members, security, and the house supervisor. The nurse could have also called the doctor to ask for orders for medications that may help calm the patient before the situation escalated to violence. Maybe this nurse was not educated in techniques to help in situations of violence. Nurses can be educated on de-escalation techniques to deal with situations of aggression in patients. This is in Casey, 2019, page 9. Workplace violence happens with healthcare providers more than it is reported. Healthcare workers have come to accept it as part of the job. Education and a clear policy on workplace violence could help nurses report occurrences and know how to deal with them properly. No patient or healthcare worker should be injured because of violence, and this should not be accepted behavior. Thank you for your time. You have a good night.